Thank you so much for joining us at the AI House on this session on longevity. One of the buzzwords out there, but what we're going to do today is to discuss not only longevity the way you hear it in the media, but we're going to address the economic imperative, the fact that it's becoming a health system in itself. And for this, we have three of the top experts to talk to you about this topic, this very topic, and I will let them introduce themselves, starting with Dimitris.
Thank you, Olivier, and pleasure to be here with you, ladies and gentlemen. My name is Dimitris Moulavasilis. I'm the Chief Executive of M42. M42 is an Abu Dhabi-based global health organization powered by AI, genomics, and digital technology with an ambition to reform the traditional care ecosystems. I will tell you more later today.
Thank you so much. My name is Evelyne Bischof. I'm very grateful to be here and welcome everyone. Thank you for the organizers. I'm a medical doctor. I'm a professor. I'm living between the Middle East and Shanghai, so I'm a little bit between those two worlds. And I'm the chief of the first in the world Healthy Longevity Medicine department in an academic public hospital, and also the president of Healthy Longevity Medicine Society, where we are trying to standardize healthy longevity medicine, make sure that it's safe, make sure that it's certified, and make sure that it is also scalable and accessible.
Great to be here. My name is Nikita Popov. I lead AI transformation at Novartis. In my job, I advocate for AI fluency for absolutely every employee of the company. So I want to do the same with you. Actually, if you're interested about my background, I suggest you use any of AI models and you ask this question. And maybe what stands out about me is I have quite unique combination. I'm trained as computer scientist, but then I also got extensive experience working with the business leaders. And I think I can bridge science, technology, and business together to drive really meaningful outcomes, very meaningful for me, outcomes that impact our lifespan and health span. And very excited to discuss this topic today.
This is really, thank you for the segue, because the lifespan to health span is key to our conversation today. And let's start with you, Dimitris. Some would say that longevity has moved into the mainstream with, like any concept that people read about, hear about, talk about, many definitions. But if we look at it from a very rigorous scientific, economic standpoint, what has changed over the past 5 years?
Indeed, Olivier, longevity, if you look 5 years back, has been perceived a luxury. Now is increasingly being treated as a health systems and economic imperative. And I think there are three shifts which converge to this direction. So the first thing is obviously scientific breakthrough. Until recently, we're focusing to treat diseases. Mm-hmm. Now we understand better day by day the underpinning behind aging and diseases, and we deploy digital biomarkers, we use genomics, longevity-focused therapeutics to delay the onset of diseases and essentially expand the health span. And we see this happening already in many healthcare systems across the globe. One example is Abu Dhabi, where over the last years we have seen some bold decisions and investments in deploying advanced digital infrastructures across the system, investing in population genomic program at entire population scale, and developing precision health population programs at scale. We see that creating outcomes, and as I will say, the Abu Dhabi's vision is not only to expand lifespan, it's not adding years to life, but adding life to years of the entire population.
And you're in a unique position as the CEO of M42 to talk about the systemic approach, since you're working on funding and developing new emerging technologies, working with payer providers, working with government. And I think this is also core to stress out how important it is to address the topic from a very systemic standpoint. Evelyne, we hear a lot about this forever healthy tagline, but from a systemic point of view, what does that mean exactly?
So I don't think forever is the good word here, and we are not striving for that. Along the entire lifespan, keeping the optimal health span is basically what we are trying to achieve, meaning at each stage of our life, and this starts pre-gestational, meaning before you are made by your parents, and then through the entire life, at each point of time, there is a unique approach, which is guided by data, by technologies, where we are trying really to target mechanisms of aging, which is starting instantly after you are created, right, as an embryo, until the end. And by targeting those mechanisms of aging, we are trying to make sure that you are at your optimal health. And this optimal will be different for everybody, right? So it will be different for everybody at each point of time of your life. And also through your life, you have events that are maybe illness, sickness, or positive ones, pregnancy. It will also alter your body, alter your health. So systematically, we also try to make sure that those life events through the life cycle are being targeted. And so it's a very general and broad thing, but it's important, I think, to understand that healthy longevity medicine is not about life extension or about biohacking. It's about making sure that at each point of time there is an optimum, both physically and also cognitively. So brain is just as important as the rest of the body, if not more. And secondly, also, we need a lot of data, as much as possible, longitudinally. So all the time through your life, to actually make the best, more suitable precision target, precision approach for a specific person. And this is for everybody, right? Not only for healthy people. This is also for people who have their diseases they were born with, they developed, they have, they are cancer survivors, they have autoimmune disease. Most of the people have something. And it's not only for people who are at advanced age, we are not geriatrics, that's a different approach, right? We are targeting the optimization of the health span.
What is really interesting to me is also to emphasize the fact that you're trained as a medical doctor. But again, you embody this systemic approach because of the work you do with companies, the fact that you also work in academia and you're tackling this way. As a human being, like all of us, I'm unbiased because I'm very biased. And as a neuroscientist, what you said is music to my brain. There is no health without brain health. And I would say there is no longevity without brain longevity as well. The dichotomy between the brain, the body, etc. We forget about that. We're talking about a system within systems. But moving from this foundation that you two very so eloquently put out there, I would like to move to you, Nikita, to move into more the scientific part of it, how we move from science to practice. And as we discussed medicine, as we discussed health systems, as we are in the AI house, there is one thing that we need to bring in this conversation is genomics. And when we think about AI, the combination, the extraordinary combination of AI and genomics, how is this going to change the landscape for prevention and prediction and treatment? Because we're moving into this precision age at the speed of light thanks to AI, but where are we exactly?
Yeah, that's. I couldn't agree more with one caveat that I think it's not about the future, it's already about today. So we already are using this very powerful combination of genetic data that is available through multiple companies that made significant investments into building this huge, massive databases, combining this with increasing power and capabilities of AI models. So maybe one very practical example how we think about it and some tangible outcomes that we were able to deliver in this space. So the moment you start thinking about how to tackle certain condition, no matter which condition it is, you need to understand which reaction in our body actually is causing us being sick, right, or having certain disease. So this process is called what we call in pharma disease understanding or target identification. Mm-hmm. Normally, what you need to find a protein within our body which actually is causing this disease. And this combination of genetics and AI is very efficient because you can build two distinct data sets. So one of them being a genetic data set of healthy individuals and another genetic data set of unhealthy individuals with a condition that you're trying to address. And then with the power of AI, you actually can compare the two between one another, and then you can knock out genes which are the same, and you are immediately down to a very small number of genes which are different. So this approach we used to find absolutely breakthrough and novel targets in diseases like Parkinson's, which the whole industry struggles because there is just a lack of fundamental understanding of why do we get this condition and most importantly how it evolves. So that's one example which I'm personally very passionate about. Then the moment you understand what is the cause and what is the protein, you can think about this protein as it's a lock in the door, but it's very unstandardized lock because it's at the door you know where to put the key. So here you do not know where to put the key. You use AI and protein folding models that I'm sure everyone heard about to actually understand where is this lock. And then further down the line, you use AI to design the key, which will be perfect to this lock and which can be able to open the door, do certain thing with a protein, and then bring us to the state that we all aspire to be.
Well, great. Now, if we take this very high-level scientific explanation, how do we take it to everybody's life? How can you help me? So I think that you're in a unique position at M42 in order, again, to create and advance the system and move from this top science that we know is fundamental and top medicine, and to turn it into solutions, products sometimes, that will affect and improve our lives, right?
Indeed, Olivier, and I think it's worth stepping back a bit and give the overall picture of M42, so I will be able to convey the message better. M42 is a unique healthcare organization because we offer services at three interconnected levels. We offer services at the health level, the patient level. We operate 480 facilities in 27 countries worldwide. We offer services at the population health level by deploying national-scale genomic programs and launching population health programs. And we're offering services at the national health system level because we are digitalizing health systems to make more effective and create interoperative data platform which allows all these interventions. Now, coming to your question, the genomics and AI are the founding stones of our journey in converting what is today an episodic reactive treatment care to preventive, predictive, and personalized care. In Abu Dhabi, where I will bring the example, we have sequenced more than 850,000 people. This is one of the most diverse and biggest data sets globally, and the single one that contains the entire population of the nation.
It's unique.
And now we're tapping on this data, and we are combining, as Nikita rightfully said, with phenotypic data. We are also the force behind the health information exchange in the Emirate. We have more than 3.5 billion health records. We're combining them with environmental data where we are tracking the wastewater across the city. And then by doing so, we can predict diseases, we can prevent illness and scale, and personalize care at the individual level for the population. Let me give you some practical examples. For all the population, we have launched, and is mandatory now, premarital and newborn screening. For example, we have screened more than 9,000 couples, and we have identified 8% of them that shouldn't have been receiving this service. They could have offspring with inherited diseases. These couples have been suggested to follow an IVF approach, not to have this risk. Or, for example, we have made pharmacogenomics available for the entire population. Today, if you live in Abu Dhabi, you can go to any institution, and for a few dollars, you can be prescribed to have a pharmacogenomics analysis which determines which drug is the right one for your metabolism, and also at which dose. And this is quite unique at the population level. Or we have massive programs where we are screening the data sets for rare diseases. And we found, for example, it went public, a young girl with an RPE65 mutation, which leads to progressive blindness. And then we have referred this young girl to the system. She received gene therapy, and this was cured. I think this is a clear example how you may move to data-led, genomic-informed care at the population level and make an impact not only on the quality of life, on the increased health span, on the prevention, but also on the cost of the system as we tackle the problem earlier before the diseases appear.
Which AI is finally affording, and we're touching at improving prevention regardless of how us human beings function, because as hard and painful as it is as human beings to admit it, we're a mess.
Olivier, maybe if I add a sentence here, I forgot to say that obviously AI is being implemented across every layer of this process. The AI and the compute power behind that is what makes it happen. Now, and this is quite exciting for all the research, we have delivered for the Department of Health the new trusted research environment that all this data eventually in the near future will be accessible to pharma companies, scientists around the world to conduct research in a safe and anonymized environment and hopefully advance further science in our region and beyond.
And as you very accurately mentioned, not just Department of Health in Abu Dhabi and the UAE, but also in many other countries where M42 operates. Yeah, we're a mess. Let's face it. If I had to summarize human beings in 2 words, those 2 words would be physicians smoke. All right? The people who are the most informed about the damage of cigarettes on the body still smoke. So we talked about population. Evelyne, I would like to go now at the individual level. Population, individual, it's whether we're talking about medicine, whether we're talking about science, economics, there is always this problem when you try to scale, or to scale up, to scale down. But individually, let's start with one thing. How can we avoid, first the perception, but then the fact that for a lot of people, longevity is a luxury? Is it true or is it not? Is it a problem of communication? Think about it. We have made, as a society, a major mistake when it comes to considering that because we're going to explain to people how to protect the environment, they will do it without thinking that the great majority of the people on the planet do not have the luxury to care about the environment because they can't even care about their own health. How can we learn from the mistakes of the climate change people in order for us to be more effective in not only delivering the scientific, the systemic solutions, but also the right message? Because at the end of the game, the day, if we do not have people who engage with a solution, that solution is useless. Evelyne, what would be your approach to that and your advice given your experience?
Great question. So first of all, I don't smoke. And then I'm so curious, actually. Can I ask the audience, who thinks that healthy longevity medicine is only for the wealthy and very exclusive? Can you raise your hands? Okay, I see few hands. Okay, don't be shy. It's fine. It's a very common thing. Healthy longevity medicine has different layers, probably just like climate protection and stuff. The point with healthy longevity medicine is that there is a very clear economic case, and that clear economic case is not short-term one, but middle-term, definitely not long-term. For any health insurance that can make proper calculation and is interested in actually making revenues by keeping people healthy, healthy longevity medicine is very attractive, and this is leading to scalability. And in several countries in this world, we have already national healthcare insurances, which cost nothing, right, to the population, that have already included a healthy longevity medicine package. It's just not a very common knowledge, but it's available in China. It's being now. We are on the way in the UAE, also with the amazing Department of Health, to do a similar thing. and many other countries. Secondly, as you know, technology is getting cheaper and cheaper. I'm working with Professor Craig Venture's Institute. He was the one who cracked the human genome and developed the first human genome screening, and still one of the top. In the last 10 years, it became cheaper by almost 400x, right? So, and this we see in most of other technologies as well. Thirdly, one of the most expensive things in medicine, besides of some of medications, are actually physicians. With the emergence of AI, even if it's imperfect, and I don't want to even go there, but with the emergence of AI, it's getting cheaper too. And it's allowing us to scale. So already right now, healthy longevity medicine is not only for ultra-high net worth people and individuals. We've seen in our department almost 3,000 people in the last 2 years for free. Why? Because the government paid for it. Because they wanted us to show that it has an economic case, and it has. Even for those people where we had a control group and an intervention group. Intervention group improved massively. Control group improved by up to 40% without seeing a physician explaining the results even. Just by them being screened for longevity. So I think education of physicians is important. I have a program that is also for free. I think education should be for free. That almost 12,000 physicians across the world took to be informed and know what's longevity medicine, what are the bases, how to talk to their patients. And secondly, educating people, what really is healthy longevity medicine, and that it does not have to cost $2 million a year is also very important. And last but not least, I mean, a big fundamental thing for healthy longevity medicine is still lifestyle, just a little bit more precise than in a general lifestyle medicine concept. And that's almost for free for everybody, wherever we are. Our colleagues in Africa with Afro Longevity confirm that it is implementable in their country as well, and they do it.
And beyond that, I used to lead health and healthcare and sit on the executive committee of the World Economic Forum, and we had a program called Leapfrogging Health Systems in Africa. And the one thing that was really interesting is that we learned from leapfrogging in Africa, then we used in some very underserved areas of the United States. So it goes both ways. There is always this idea that we're gonna help underserved countries, as we would consider them, but in fact, by helping one population, we can also learn and adapt, because with AI, with scaling, with precision, we can do that. Thank you very much for bringing the economics of it, because that is going to be my next point with you, Nikita. When we move into the questions that are related to the economics of longevity, for starters, can we share with us what would be the bottlenecks for the adoption of AI-powered solutions that will improve healthy and longevity and its access? What are these key bottlenecks? Because we see that AI is everywhere, which for a lot of sectors means nowhere if it's not used properly. Like any tool, if it's not mastered, if you don't use it with the right data, the right people, etc., you go nowhere. Bottlenecks, please.
Yeah, absolutely. I mean, first of all, I would absolutely agree with Dimitris and Evelyne on perspective that longevity is around health span. It's not about the lifespan. At least this is how we think internally about it. And what makes our company quite unique is that we have a dedicated effort and a disease area that we call area of aging and regeneration. And that's a very, I would say, mindful investment from the company, quite unique in the industry. But when it comes to science and the bottlenecks that you're asking, reality is that we want to scale longevity when it comes to access to as many people as we can. So it's really about scale. When it comes to science, you actually want to go from scale and one pill, which will actually fit absolutely everyone, to much better understanding and much better precision, knowing over time that our body bodies and biology is so complex that this one single pill will not work for everyone in this room. So that's where science is going. And when it comes to the bottlenecks, then of course, first of all, disease understanding and biology. When we train all these foundational models, we obviously train them on our knowledge. But the reality in biology is that our knowledge is probably 5% of what we would love to know about the subject. So a lot of things we just do not understand. Why are they happening? Hence, we cannot define and design a drug which would perfectly work and perfectly treat conditions. So that's the ongoing area of research, and I think that's quite significant bottleneck for the years, maybe decades to come for us scientifically to unlock. Another one, which is very important and close to my heart as well, is you might know the way how drug discovery process works, and that you first start testing your potential drugs on the animal models, and then the moment they are safe and efficient, you are introducing them to the humans. In this very process, unfortunately, outcomes that we're seeing in animal models very often do not translate to what we're seeing in humans, and especially in the areas of safety. So, for example, a drug can be safe, but then the moment you start testing it with humans, you can see certain side effects, and then the programs are closed. And when you think about perspective of economics, actually how expensive it is to develop a drug and how long it takes. So, on average, I think it costs us $2.5 billion. And we spend more than 10 years to deliver one medicine to the market. So it's really costly process with a lot of bottlenecks, with a lot of uncertainty. Our probability of success is less than 10% from the moment that we start developing the drug.
But we're seeing an acceleration in, well, thanks to AI, but also decreasing of some costs, because if not predicting the silver bullet, if I may say, but at least knowing what will not work. And we see with precision medicine, when it comes to helping patients avoid testing chemotherapy, because we know some treatments will not work on people. We cannot guarantee they would work, but at least you can avoid suffering. You can avoid spending 6 months just, hey, let's see how it works on you, which at the really individual level is amazing, but also at a societal level, because of all the people who are affected by what is being done. Because we're talking about the health, the lifespan of the individual, but there is also all the people around that benefit from that.
Yeah, if I might comment, you gave wonderful example of chemotherapy, right? So that's the area where we actually are going from, I would say, this broad-scale treatment of let's just make a chemotherapy which would kill all bad and all good in our body, to precision therapies. They're called radioligand therapies. So this is one of the breakthrough innovations that Novartis actually introduced, where we're able to attach a small radioactive isotope to the drug and then deliver it, target it to our body. So do not affect the whole body, rather affect only the area which is cancerous and kill cells
right.
that you're willing to. So I think that shows you direction of where we want to go and how we want to understand our bodies and treat them.
Absolutely. Dimitris, you're in a unique position because you, with M42 and the extended G42 ecosystem, embody the concept of multi-stakeholder that the World Economic Forum and Davos have been all about for so long. When we look at prevention, we're still looking at some fixing rather than anticipating. How, with not only AI, but the fact that you can connect the dots, speaking to payer providers, governments, patient association, top researchers, academia, etc., what progress can we anticipate or already share on things that have dramatically changed thanks to AI development and what M42 is doing in the UAE and abroad?
Let me say, Olivier, that let me first say that we live in a paradox. I mean, we are in an era with all these scientific marvels, and still you see around us, and we're exposed in 27 countries. Most of the health systems are designed as they were in the 70s, treating disease and reimbursing treatments. I think there are three main factors for that. I think there is a misalignment on incentives. There is a lack of visibility, and in some cases, lack of infrastructure. Today, we are still getting incentivized to deliver volume instead of value. We are paid to do the next dialysis treatment or the next MRI service, not deliver outcomes. We see that because of the short political cycles, often policymakers decide to make quick wins as to invest in prevention programs and infrastructure which is going to pay back in the future. And then we see that there's no visibility really because of the lack of data. There's no visibility on how fast this will work. Plus, there's a lack of infrastructure. There's a lack of data. So, however, we see I'm optimist. Having said that, we see that there are directions that are moving to this new era. One is that we see across many countries that policymakers and providers, they come together, they are redesigning their care blueprint, and they are focusing on outcomes. We see that countries are investing in health information exchange systems. This provides the right data to make investment in prevention and longevity both measurable and fundable. And then there's an economic necessity. Today, all the systems that are under strain, you have the rise of chronic diseases, you have aging population, and then more and more governments are entering this dialogue. So those three factors makes us hopeful that we'll move the needle towards a prevention-first care models. And we see that we, at least as M42, we have several collaborations across the globe. Recently, we digitalized all the Jordan healthcare system. We are helping the Uzbekistan government launch their own population genomic program and move towards this new predictive, precise, and preventive care.
One thing that is interesting is when we talk about access and maybe increasing the divide to access between people depending on what treatment, what solution. One thing that is rarely discussed is how regulation is creating a divide. When you think about certain areas of the world, let's not name them yet, where regulation on AI is slowing down the fact that some solutions that could save lives are staying in the labs just because there are regulatory issues and the people who are putting out these regulations don't really know what these things are about. That's the number one key issue, that there are inequalities that are not based on finance, economic power, just because some people who regulate do not realize that the fact that you do not give access to the wealth of data that is out there, because there is a difference between the data sets not existing and not having access to data sets in order to train the models. That is number one. And that difference is due to issues with regulation. And I think that one of the key misalignments is the fact that we have different tempos, let's put it this way in a very diplomatic way, between the regulators and the innovators and the doers. That's always been the case. But that gap, that misalignment has never been as huge and exponential as it is now. So moving forward, I would love to hear from you guys. We're going to move into the behavioral aspects, because at the end, we mentioned it before, if people do not engage, if people do not have access, how would we engage them? And I'm going to have each of you answer a question that is inspired by a quote by David Guetta.
Okay.
David Guetta was asked, hey, David Guetta, do you have a recipe for releasing hits? He said, no, I don't. But my talent is not to release bad songs. So with that logic, we do not have a silver bullet, but from your various expertise, what are the things we should stop doing in order to at least prevent some hurdles to exist?
If I go first, so I think, and I will connect also to your comment about the low-resource countries leapfrogging the system. I think we should start investing in different type of infrastructure, like in data, to try to leapfrog the model and don't move through the heavy brick-and-mortar hospitals, but collect all the right data required to deploy personalized care at scale. I think this is a different way to approach care today. It needs a different health policy, and it needs an alignment between policymakers, providers, researchers, institutions in countries. This would have been my advice.
Evelyne.
I think it's almost easier to say what not to do.
Yeah, exactly.
Right.
Do not release the bad song, so what should we stop doing?
Right, but it's harder to do. So I think one of the things we should definitely stop is to overregulate things that can allow scalability with a very, very reasonable ethical and safety profile. And secondly, do not follow trends that are just not evidence-based and complicated, because it creates a hurdle for those who are trying to do good things to move forward. And unfortunately, we are spammed and scammed very much through social media on what is healthy longevity medicine, what is AI not. And then the voices of those who are actually leading the field, who are clearly busier than spending time on Instagram or TikTok, are not being heard. So do not follow not credible sources. There are very credible ones, that you can always look up, and do not engage in things that would rather keep the rest of the world even slower in advancing.
You touched such an important point. We live in a world where someone's opinion sometimes is treated as equivalent to scientific and medical facts. Again, a decade ago, if you were in Davos on the official program, there were a lot more scientists. There were a lot more physicians part of a program. And this speaks volumes about where we go at the moment. You also mentioned a point on social media. I work on helping surgeons and the burnout issues in surgeons. Part of the cognitive load they have is the fact that now patients come with unrealistic expectations from what they read, heard on social media. So this directly impacts patient outcome. Nikita, same thing. Yep. From your angle, with a more scientific pharma angle, what should we stop doing in order to promote and let people engage more with best practices?
My answer, I would build on what you both said, because I absolutely agree, and it will be double negative. So it would be, you should stop, like you personally, you should stop ignoring silent symptoms, and you should stop ignoring signs. Because as example, what is the leading cause of death on this planet? We all think it's cancer. No, it's not cancer. It's heart-related conditions. And the reason why it's the leading cause of death is that symptoms with these diseases, they are very silent. So we just live normal lives and we do not notice that we might be developing something that eventually will prevent us from living longer lives. And there is a lot of science around it. So as example, we know that bad cholesterol, LDL, is one of the factors that is driving these outcomes that we're trying to prevent. And still, even when we first do not do tests, and secondly, when we see numbers which are outside of the healthy ranges, we do nothing. As an example of what can be done, Novartis runs a program which I absolutely love. It's called Cardio for Cities. So we started with 3 cities, one in Brazil, one in Senegal, one in Mongolia, to actually convince governments and develop the programs where we can go from reaction to prediction and to prevention. And by doing this, we're seeing absolutely tremendous results. We can decrease by more than 10% cases of strokes, cases of heart attacks, just by simply stopping to ignore the silent symptoms that we're developing over time. So I would really stop ignoring the symptoms, and it's personal responsibility. No one would come to you and say, hey, you need to do that.
Well, thank you for bringing one aspect also where Novartis was showing some leadership, which is on the behavioral science front. I have worked with Antoine Ferrer when he was leading the practice at Novartis. And I think this is important because as we move into the behavior and the last part of this conversation, I would love to talk about trust. Every year in Davos, on Tuesday morning, there is the trust barometer that sets the pace on the latest data on what people trust, what they don't trust. You know, the fact that institutions are less trusted. It seems that scientists and, physicians are less trusted than before. And to the point Evelyne shared earlier, influencers on social media are trusted. So now we're facing a dilemma. Do we need to fight what is happening online, or do we need to do judo with it to leverage its power in order to steer it in a way? I am notorious for having upset a bunch of physicians by saying that the people who know best human behavior do not work in medical practices, in hospitals, they work at Netflix, they work at Walmart, they work at Amazon, because they can engage and re-engage people. And the fact that we consider that the patient, when the patient is with a physician, is different than the consumer is not true. It's the same person that buys a soda in the morning and goes to a doctor in the afternoon. And there were a lot of learnings that came from consumer neuroscience that help payers and providers engage people. So, as we talk about trust, should we leverage the power of social media that we cannot fight, but use it, again, doing judo? And what would be, each of you, your advice, knowing what you know, with your practical knowledge, but also the theoretical one, on increasing trust in what the good practices are in order for people to engage? Because at the end of the day, we're back to that problem. If people do not trust, people will not engage. If they don't engage, you can do whatever you want. It will end up being almost useless. Dimitris.
Yeah, I think we'll answer as follows. I think trust in institutions is imperative. If you trust institutions, healthcare providers, the role of artificial intelligence, we're all going to be in a great place. Social media is a channel to try to diffuse this trust by communicating the right messages, I think.
And trust in institutions, we both live in a country where people trust the institution based on one thing, outcomes. If the outcomes are positive for people, people are trusting the institutions. I come from a country where there is a huge misalignment between what is being said at the government level and what people experience in their daily lives and how they see their taxes being used. And then you don't trust the institution if the outcome is not good at the individual or population level.
I think if I may say personal experience.
Sure.
I could see that during the COVID time. I recall I used to live in Copenhagen for many years, and I recall when the government said that tomorrow morning all children up to 5-year-old may have the vaccine. Mm-hmm. They had long queues with blonde young boys and girls getting vaccinated. I could contrast that with my home country, not to insult anybody, which is Greece, while in Copenhagen there was like a 90-something% vaccination. Greece was like at 70s. There were some other countries I used to work. It was even lower. I mean, I think trust institutions also connects to the rate you adopt innovation when you know that it's well thought, protected, regulated to serve you.
Yeah.
And I think trust is very important to close this.
French media during COVID were asking people which vaccine they prefer. Which one's your favorite? Really? So it's not just influencers on social media. You also have legacy media that are spreading information that can be dangerous. Because, if you see someone you like saying, no, I prefer this one to this one, you're like, no. Then you're going to bug your physician by saying, why are you giving me that vaccine? I'm like the other guy. I want that. Because this is how it works for clothes, for sodas, for everything.
Olivier, can I add also one more thing from my Abu Dhabi experience the last 18 months is that today there are many studies that the Abu Dhabi and the UAE population have immense trust on AI. Mm-hmm. Is maybe the nation that trusts more the AI because they trust institutions, and that's why you have all this rapid growth to all these initiatives I referred before, where AI is a critical component.
Well, because it's aligned again, because there is a university that is dedicated to AI that is not only working on science and technology, but also upskilling the country with an academy. And that creates trust because people are getting upskilled and embracing and using it with good
Europe
outcomes.
still doesn't trust AI, and this is extremely important for Europe to keep up. China trusts AI, UAE trusts AI.
Let's not even dive
Europe
with the European issues. There'll be a lot of conversations started at the beginning of the afternoon on that. Evelyne, you represent here the people who are at the core of helping us, making us healthy, fixing our issues, our health issues. Yet there is also a crisis in trust in physicians, which seems surreal when you think about it, but it is a fact. What for you would be the next step in order to restore some levels of trust?
I think on the one hand, there is a lot of people who name themselves physicians, very many longevity physicians. There is no certification that would allow you to name yourself longevity physician as of now. There is no. And it's the same as if you would go to a cardiologist who would say, I'm a cardiologist. Based on what? You never ask as a patient because you actually have this fundamental level of trust that the physician would not lie about their accreditation. So there is a good reason to not to trust a lot what some of the physicians are saying, and especially those who are, also trying to focus more on influencing than on seeing patients and treating people. I think academic physicians have the responsibility to lead in terms of restoring the trust of what has been damaged through several pandemics and other issues in the world. And I agree 100%, and we are trying very much, and it's very difficult to actually work with those organizations who understand much, much better how to spread the news in the right way to make it understandable to people. I very often catch myself that I'm explaining something and there are square eyes in front of me, and then I have to adjust, and it's difficult if you have a limited time. So facilitating collaborations with any organization that is very good at using AI actually to reach people and has the right algorithms to convey it to the people in the right way. So ultimately increasing the health literacy across populations and adjust it to different populations is very, very crucial. And luckily, some of those organizations are working with us already. Here again, China is leading the way with Alibaba, Ali Health, and many, many others. UAE is pretty much right after, Saudi Arabia, and so on. So that's number one. Number two is really, every time I see people, I just say, really, if your physician that you follow spends more time on Instagram than in the practice, it's probably best to verify through other organizations who are, represented by somebody who is actively working on checking the evidence. And there is Healthy Longevity Medicine Society. There are standards by the government, constitutional in the UAE, who is and who is not a longevity clinic. And, when you Google about longevity, Google also about illnesses, side effects, and death cases that happened through different experiments that you basically do on yourself that are promoted as evidence-based, because ultimately it's your health, it's your life, and at this point of time, as we speak, there are plenty of people who lost their life because they wanted to be healthier and use things that they believed and trusted in that were untrusted.
Yeah, we need to avoid with longevity what we've witnessed with crypto, the metaverse, or AI. People who self-proclaim experts overnight, well, they did a good career advising on crypto. They see a new trend in AI, and just because they use ChatGPT more than you, they are experts in that. So we're starting to see this on longevity as well. Nikita.
Olivier, when I'm thinking about trust, I'm actually looking at this very stage, and I think about collaboration and I think about partnership. Because for any single organization which is represented, be it academia, be it the healthcare system or pharma, it's impossible to go alone and solve these issues that we're here to solve. And I deeply believe, and I have a lot of proof points from our internal work, that only by collaborating, only by I would say combining best from all of these worlds, we would be able to crack this very difficult areas that, as I said, we have unfortunately a bit limited understanding. Only if we are able to share data, if we are able to bring best science to people who are actually providing access and education to populations, if we can partner with academia on the latest research and integrate this research in the existing scientific programs that are being driven, only then I think we can have a shot on goal in such complex problems that we're trying to tackle.
Absolutely. Like Evelyne mentioned, the fact that when you're training in medicine, you're not trained in communicating about medicine. You're not trained into breaking bad news to people because there is so much to learn about the biology, but the biology being tied to the physiology, being tied to also the behavior and psychology of people needs to be integrated. What I gather from what you said is that we're here. The World Economic Forum is the foremost organization for public-private partnerships. And I think we're the PPP. And what you mentioned is that we need to add one P to it. And this does not come from me, but from one excellency from the UAE that spoke yesterday. We need to move into public, private, and people partnership in order to be able to scale things. So PPPP. This said, my last question to all three very quickly. Share what your experts are doing for your own longevity. It's always good to know from the people who preach if they walk the talk. Dimitris,
should I go first? Okay. So I think I don't know. I think my first breakthrough is that I developed the right awareness with all these lifestyle wearables. I use several of them, and I compare data which helped me adjust lifestyle, including improving my sleep. And I think by understanding better what metrics such as HRV, heart rate variation, the VO2 max do to you and the importance of sleep and exercise, I think awareness, I would say awareness is the big message, is what made me have a healthy lifestyle versus the past.
Are you one of these people who do the first thing in the morning is to look at the sleeping score, and if it's not good, stress?
I actually look at trajectories, and I use AI to compare the different metrics, and I rely on trajectories because
let's say that as the CEO of M42, you have access to innovation and technology that most of us don't. Evelyne, what about you?
Actually, some of the things that are really, really easy to apply with good discipline. So intermittent fasting and optimization on the sleep architecture. And then, muscle all of the time whenever there is time for this. But I put almost like 50% body, 50% brain. So cognitive testing, dual cognitive training, and cognitive challenges. This is on my priority list.
Nikita.
Yeah, absolutely. One of my favorite convictions is that if you can measure, you can manage. So first, it's starting with data collection. Also a big fan of Whoop, and I like to monitor this data. And I think it's less about point in time, it's more about trends that I'm trying to observe. But then obviously, what would you expect from me? Of course, I use AI. I use AI to analyze all this data to give me targeted recommendations. I use AI to advise me on diet. I use AI to help me create better exercise plans and honestly motivate me to wake up in the morning and go to the gym. I'm just trying to live what I'm preaching for, to be honest.
Well, thank you so very much for sharing your insights, your expertise. Congratulations on the work each of you is doing separately and together. Please join me in giving a big round of applause for our panel.
Thank you.